Hello, Dr. James Bogash, expert in health and longevity. And at the beginning of the pandemic, I had said that what's going to happen is we're going to find out a lot of information, or let's say confirm a lot of information, because most of this intuitively made sense. Like, the better we took care of ourselves, the better the outcomes. In the middle of it all, you wouldn't think that because that message was not getting out. Even now, we have successfully avoided for 4 years talking about healthy lifestyle changes and how they play a role in our entire experience with respiratory viral infections. So congratulations to public health on that one. So this was a study looking at long COVID, which any post-viral scenario, I've said before, like, it happens. And the healthier we are, the lower the risk of post-viral illnesses go. Things like vitamin D status, exercise, diet, all of those things play a role. So in this study looking at 422 women between 18 and 34, so a younger age group, and looking at divided them up between low, moderate, and high levels of physical activity. And what they found was that the women with the higher levels of physical activity had lower mental neurologic issues, which was the biggest category of post-COVID stuff, things like fatigue, depression, cognition, all of those things. So they had a lower risk of those problems if they experienced long COVID. And really every symptom of long COVID was lower in those with higher levels of physical activity. They also had a lower risk of reinfection with higher levels of physical activity. Again, we kind of knew that. We just didn't get the word out. So really just boils down, like, we need to be moving. If we're not moving, there's going to be consequences. And that's fine if you chose to sit on the couch and drink beer during the pandemic, but you have to understand that there are ramifications for those decisions, as opposed to, like, again, shutting down gyms, shutting down the beaches. Like, we made a lot of wrong decisions, and these weren't, looking back, we didn't know. Like, we knew that those were bad decisions, and we should have been educating people about empowerment and taking better care of themselves, which we did not, and still do not do, which is a continual frustration of mine. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.